Testosterone replacement therapy is just what it says. It's giving patients testosterone levels, not to get them to super physiologic levels, but to get their levels of testosterone into a normal range.
If a man has sexual dysfunction, low sex drive, erectile dysfunction, problems with ejaculation, if they're lethargic, they're taking naps during the day, if they feel like their physical strength and endurance at the gym is bad, they're working out regularly, they're eating well, but they're having trouble losing fat and putting on muscle mass. If they have symptoms like that and they have a blood test that confirms the diagnosis of testosterone deficiency, then that patient is a candidate for therapy.
So there are men who have low testosterone levels who feel perfectly fine. They're happy with their libido, they're happy with their energy, their mentation is good, they're not depressed. In those patients, we certainly don't recommend testosterone replacement therapy. However, that same patient who has a low testosterone but is symptomatic and not happy with the way they feel, it's certainly reasonable to talk to them about testosterone replacement therapy. So the major forms of testosterone are injections, transdermal administration of testosterone, and implantation of testosterone pellets beneath the skin. So again, there's a whole array of therapies, and they make sense to individuals for different reasons.
With injections, the day or two after an injection, you get a very high level, and then that declines over the course of the time period before the next injection. So people usually inject every 1 or 2 weeks with these shorter acting injectable drugs. So they get a peak level, and then that goes down to what's called a trough, so where it bottoms out right before you get the next injection. And you need to be with the doctor to monitor to make sure that your peak isn't too high and that your trough level isn't below where you want it to be.
I think the therapy that is most commonly utilized now is what's called transdermal testosterone therapy, which is a gel that is applied at various parts of the body. Testosterone is absorbed from that gel. Now that's a very convenient way of giving testosterone, but it has some concerns that are associated with it, and this has to be discussed with the patient. For instance, the testosterone gel, if it's not allowed to dry adequately on the body, can be transmitted to a child or to a spouse.
There's another form of testosterone replacement in which pellets are actually inserted under the skin. So they're called subdermal pellets. They've been around since the 1940s. And those require an actual procedure by a physician. But it has the advantage of providing continuous testosterone replacement for 3 to 6 months. And of course, there's no risk of transfer to anybody else.
Replacing that testosterone restores someone to a normal state, and the normal state is the resolution of some of those symptoms. We also need to make sure that there's not adverse consequences of the testosterone replacement therapy. So testosterone therapy can cause abnormalities in terms of blood counts. Some people actually become irritable, even more aggressive. People may have progression of their hair loss. Some people experience some acne as a result of testosterone as well, as if they were going through puberty.